Good morning, everyone. All right, welcome everybody. I'm going to go ahead and get started. I want to first of all introduce myself. My name is Bruce James. I'm Deputy CISO at Intermountain Health, based here in Salt Lake City, Utah. My handle is Brucifer, and if y'all want to talk about healthcare cybersecurity, I run the healthcare hacking community that's downstairs on the expo floor. So would be glad to talk with any of you down there afterwards if you have questions or comments about what I'm going to be talking about today. Now, I intentionally went with a title that was meant to drive people away and bore you a little bit, and I think it sort of worked, but actually, I'm glad you're here. If you have an interest in healthcare cybersecurity, we're going to talk a little bit about what's happening at the national level, and what a public-private partnership is doing today. So, before I dive in just a little bit, I need to define an acronym that's on the board here. HPH stands for Healthcare and Public Health. That's one of the 17 critical infrastructures that are defined for the United States by the federal government. And really what I'm going to be talking about are the cybersecurity performance goals and kind of how we got to those. So to start with, I need to give you a little bit of history on this public-private partnership. There is a group called the Health Sector Coordinating Council. This was established in 2003, again, established by the federal government. Most recently, it's not quite on the board here, but in 2015, there was an act passed by Congress called the Cybersecurity Information Sharing Act, called CISA. And of course, we're reusing acronyms just to confuse everybody. But that act in 2015 had a section in it, Section 405D. And 405D, if I'm referencing it, it is really about that section in the law and what's going on there. This group is a group of different parts of the federal government. So you will have representatives from the FBI, from CISA, from the different parts of the federal government, and then you've got leaders and healthcare organizations that come together and they talk about the cybersecurity of the healthcare industry in general. Part of that Act of 405D in 2015 defined that within 3 years that group needed to publish some practices, and that's what was published in 2018. It's HICP is Health Industry Cybersecurity Practices, affectionately known as HICCUP. So there you go. If you hear me saying hiccup, I'm talking about this particular publication. Now what it is, and I would suggest if you are doing anything in the healthcare industry that you go look up HICCUP. It can be a very, very helpful document. This was really put together with the goal of improving the cybersecurity of healthcare organizations overall, because let's face it, the cybersecurity in those orgs are not really great. Okay, so this document has suggested good practices for healthcare organizations, and it's actually split up into three main parts of the document: one for small organizations, one for medium, and one for large. And really the thought is that, if you take something like Intermountain Healthcare, we're 60,000 employees, we're approximately 80,000 affiliates that work in our hospitals, so about 140,000 individuals that we're having to secure this organization for. And you compare us to an independent clinic down the street with a single doctor whose IT department may be somebody that they're hiring in part-time, or they're consulting out with somebody to do. If you're trying to secure both organizations, it is night and day, right? between what you do in a large and a small organization. So this hiccup document is very, very helpful in really taking it from the perspective of, if I need to secure an organization from the start or an organization that's already had a history, let's look at it and see what's the good practice to do. I tend to tell people too that aren't necessarily in the healthcare industry that it's actually a really, really good resource. Through my career, I've worked for very small startups up through several large organizations. And, in the startup days when I was the sole cyber person for the organization, I would have loved to have something like this to look at and really help me guide and put a strategy together. So again, that's hiccup. Some of these others I won't go so deep into. In 2021, there was an amendment to the HITECH Act, and that PL there stands for Public Law 116-321. What this did was actually put a bit of incentive to the good practices that are published in hiccup. Let's say you're an organization, healthcare org, and you've had a breach of patient information. And what generally happens is you have HHS and some of their groups come in, and they will actually evaluate you as an organization, see what occurred with the breach, and they may levy fines. This public law actually has the ability to reduce those fines if you can show that you followed the hiccup best practices or good practices. So that's what that does. Now, most recently in the last year, there's been a lot more effort, and that's what these other three items are on here. The landscape analysis, I'm going to delve a little bit deeper into that in a few minutes, but essentially what we got to after approximately 5 years of having these hiccup practices out there was that we were still having major breaches due to really basic issues, right? And we tend to have these situations where an organization has a breach and you get legal involved, and suddenly they don't want you to tell anybody anything. And I understand why. I'm not here to debate that or anything. But sharing information about what occurred and what happened can be very, very locked down. So this landscape analysis was designed to work around that process and find out, how are we actually getting beat? How are we actually getting breached? And there's some really interesting information that comes out of it. We'll talk about that in just a minute. Based on some of that, later on in 2023, HHS released their concept paper. This is essentially their strategy for cybersecurity and healthcare over the next, I don't remember off the top of my head, but over the next, I think, 3 to 5 years, something along those lines. Okay. And then this last item here, the CPGs, those cyber performance goals, are the first step in that strategy. So again, what's happening with these goals, and I'll dig a little deeper in them, but what's happening with these goals these are what we should do as a healthcare industry in the next few years. Okay. Now I'm going to jump back to the landscape analysis. We added a bit more weight to what was found in this landscape analysis when we experienced the Change Healthcare breach earlier on this year. I think it surprised a lot of organizations just how much we actually depend on other third parties to get certain key parts of our businesses to work, much less to keep working when they shut down their services. And this concept that's being pushed by the Health Sector Coordinating Council is really that what we need to do next is evolve as a healthcare industry, is evolve beyond protecting just our organization. We need to protect the whole healthcare industry, the whole environment. And we need to move on to a position where instead of beating one of us one at a time, like those malicious actors are doing, we need to make sure that if we beat one of us, that we are not beating all of us, that all of us together are working together to strengthen the healthcare industry and the environment in the United States. So with that in mind, let's jump along to findings of the landscape analysis. I'll just pause and say there was the official landscape analysis, questionnaires, conversations, and things along those lines that occurred. And then, as I mentioned earlier, as we know, sometimes organizations don't want to allow certain information to be given out. So there was also kind of an unofficial conversations that occurred as well that really validated these findings. What we found are that there are three major ways that we're being hacked, three entry points. Okay, and these should not be surprises really to anybody who's spent any time in cybersecurity in general. Social engineering, I mean, you can read them right here. Social engineering, either through the help desk, through email, phishing, or through some other method. Third-party compromise, which really gets into if I beat a vendor and get into their system and they've got a VPN into the larger healthcare organization, we use that and we pivot into their environment. And then the third is vulnerabilities. As I'm sure you're aware, there are many ways to find vulnerabilities on systems that are open on the internet. Again, talking about Change Healthcare, that was one server that was available on the internet without multi-factor authentication on it was the entry point. It wasn't necessarily how the ransomware was deployed, but that was the entry point. But all the methods point to the one component, this privileged escalation. And I know there's small print there. It's so small I can't even read it here. But the real key point here is that in every situation for every organization that responded to this, either officially or unofficially, what occurred was that somebody got Active Directory domain privileges, whether that is through a domain administrator account or a domain administrator equivalent account. And the fun thing about domain administrator equivalency is that in many cases, I say fun, it's not really fun. In many cases, you may not know that an account actually has the ability to do some really fun or really dangerous things in the Active Directory domain. And won't necessarily go into details, but I mean, you can think about some things like an Exchange administrator account may have the ability to allow this domain equivalent to deploy ransomware or to do other things. Same with SharePoint content administrators, things that you just wouldn't think should have the ability to do that. Okay. Okay, we'll move along. So really, after doing that landscape analysis and getting the strategy set for the organization or for the federal government and the industry, we moved along to these cybersecurity performance goals. And really, I'm going to show a little more detail in the next couple slides, but essentially, again, these are things that we should be doing as we're moving forward. Now, we split these into essential and enhanced. And basically, essential is saying, okay, take all of those good practices from the hiccup documents, and let's find the ones that are essential for us, whether you're small, medium, or large organization. What is the very basic thing that you need to do to secure your organization? And those should be our goals. If you have any power in your organization to make a change, look at these, and if you've got gaps, focus there, get them done. This is going to help the industry as a whole. Enhanced is really to the point where you've done the essentials. You're maturing as an organization as far as cybersecurity. These are the next really, really good things to do. Okay. One key point again on this is that these are goals. This is not being required of anybody to do. It's voluntary today. Okay. Here's a list of the 10 essential CPGs. Again, none of these should probably really be surprising. I'm not going to read these word for word for you, but I won't read the details. I'm going to say all of them though, so that you kind of cement this in your heads a little bit. Mitigate your known vulnerabilities. Do basic email security. multi-factor authentication. On this one, I'll pause and say again, back to the Change Healthcare issue. If you've got even one server that's internet adjacent or available to access from the internet that doesn't have multi-factor on it today, that just needs to be fixed. That needs to be priority. Get that done, okay? Basic cybersecurity training gets back to making sure that your employees and your caregivers and whoever's in your environment really just knows the basics about how to protect themselves and the organization. Strong encryption should go without saying. We should be way past the days where we're having the arguments of, oh, I didn't turn the SSL on this internal web server because it's internal. No, we can't trust our internal networks anymore. Turn on that basic strong encryption. Revoke credentials gets back to what I was talking about with domain admin or domain admin equivalency. Find those credentials that have the higher level of access and revoke them. Get rid of them. Okay, especially for anybody who has left your organization, even just basic credentials there. That's something we see all the time, I would say, in the industry is people entering using credentials for somebody whose employment was terminated months ago, and yet the account's still active, right? Basic incident planning and preparedness. Have a plan for when the breach occurs, because the breach will occur. It's no longer if it will occur, it will occur. Be ready for it. Unique credentials. This one's a fun one. Each person should have one credential, and it should not be shared. Oh, okay, thank you. No, this is a big one. See it all the time, especially with smaller clinics that we do business with sometimes. They all have one credential to get into the EMR, and all 20 of the staff members use that same password and that same user ID. Just, we were way past the days when that should be done. Separate your user and privileged accounts so that, again, if you get back to, let's say, an exchange administrator, when they're checking their email for work, they should not be using the same user ID and password and other credentials that they use to actually administer Microsoft Exchange. Okay? Vendor, supplier, and cybersecurity requirements. This is where we need to work together to enhance and strengthen the healthcare industry, is that we need to make sure that we are holding our vendors and our suppliers to the same level of security that we hold ourselves to. Okay, and there's that could be a whole talk and all on its own. I won't go there. In interest of time, I'm not going to delve too deeply into any of these, but I will make a couple statements. First, asset inventory, and again, these are things to do as you mature. I had a conversation with the CISO at Cleveland Clinic about asset inventory, and his quote on it was along the lines of, we've been trying to do a good asset inventory in healthcare for several decades now, and it's always a big challenge. I think the way he put it was, if you imagine Disneyland and you understand all the guests that are coming in, and you understand all the employees or cast members that are coming in through the tunnels underneath, and you've got the service entrances in the back, you've got all these entry points into this environment, and you're trying to track where every single person is all the time, every day, every minute, maybe even less than every minute. That is a monumental undertaking. Yet that's what we're asking for asset inventory. So that's one reason why it's in the enhanced area. Third-party vulnerability disclosure. Make sure we're talking amongst organizations when there's vulnerabilities. Same with incident reporting. Actually test your cybersecurity, and definitely have your own people test, and definitely have a third-party test, and maybe multiple third parties. Mitigation of vulnerabilities as soon as you possibly can when they come about. I know that again, any of these could be big, long conversations or presentations on their own. Detect and respond to relevant threats. Network segmentation. is a big challenge in healthcare for the same reason that I just talked about that Disneyland scenario. It's hard to isolate everything going on in Tomorrowland from the rest of Disneyland. Centralized log collection. So if you've got a SOC, whether it's in-house or out, how are they collecting their logs? Is it centralized, and is it actually being looked at as a single whole rather than looking at logs of independent systems? Centralized incident planning and preparedness, and configuration management. Okay, so moving along, I mentioned earlier, a lot of this stuff is voluntary, but we're moving towards mandatory compliance with some things here in the in the United States. So some of this here, the reasoning for making some of this mandatory is the increase in the breaches within the United States. We haven't compiled numbers for 2024 yet, but I expect that to be a curve going up here. An interesting study that's quoted here, though, that more or less for the first time we can actually tie patient health and death, unfortunately, to ransomware attacks based on these studies. So, this is the heavy weight for anybody, heavy weight on your shoulders for anybody in healthcare, is knowing that patient lives and well-being are associated with your work. Okay, so as far as mandatory components, the budget for fiscal year 2025 for Health and Human Services includes incentives and penalties for for meeting the cybersecurity the goals here. Okay, and as you look at some of those numbers, they look exceptionally low if you think about how much is spent by healthcare in the United States per year. Only $800 million to help hospitals in 2027 and 2028 to adopt those essential CPGs. It's not a lot of money, but it is an incentive. Okay. And then, as you can see, basically in 2031 is when the penalties will start coming in, right? If you have a breach and you have not met the goals, right? Now, as usual, there's a whole political side to this. There's a whole legal side to this that I'm not going to delve into. We don't have time, but it's something to watch and understand that these things are coming. Okay? So what can we do today? We can get a head start. So as part of this publication, they more or less defined impact and effort associated with implementing some of these goals. And so, yes, this is a kind of a rough swag at what you would need to do, but I mean, you can really take a look at this really easily and say, what's the most important thing I can do for the lowest amount of effort? Let's just do basic email security, right? That's right there at the top. Whereas something like strong encryption is a bit more difficult, that medium effort, and has a lower impact. And then same with the enhanced CPGs. And I'll leave these here for just a minute. So to wrap this up, rather than worry about everything that's on my slides and all the content that's out there, I'm going to provide some resources. Take a photo if you want real quick, because some of those URLs are a little long. I tried to throw some QR codes on there for you. And like I said earlier, if you want to talk about this a little bit more, and you want to spend some time working on it, please come down to the community downstairs, and I and the other volunteers that are there will be really happy to talk through some of this with you. Now, I know I'm right at time, but I'm going to explain my very last slide first before I move to it. To this concept of we should all be working together to protect the healthcare industry. And just because, it's 2024, we added an AI component to this, and that's on the next slide here. My boss very frustrated with the way things are running. And this is earlier this year, actually, before the Change Healthcare incident. Was really worried about the fact that when we're doing risk assessments of our third-party vendors, each organization spends a lot of time, builds these huge questionnaires, and we spend a lot of time talking with our vendors and having them fill things out, and everybody's questionnaire is different. It's a really heavy process, and we can spend some time and we can make sure that that one vendor is working really well for, let's say, Intermountain Health, but maybe they're not doing so good of a job for another healthcare organization, and they get taken down, and that affects Intermountain, which can affect populations and their health, in many different areas. And it really does turn into this whole national issue that we should be stronger together. So with his frustration on that, he put a prompt into this AI and asked it to really visualize this. So here's the prompt. Hundreds of risk analysts pulling out their clipboards, screaming at one another to assess the velocity of the fire, the angle, the magnitude, as they just sit there watching it burn down the city. And that's the image it gave. A little bit kind of scary and a little bit crazy, but it's kind of where we're at. We're spending so much time worrying about ourselves that we're not worrying about us together. So that's kind of my ask for everybody here that is in that healthcare industry. Let's all work together. Let's prevent these big fires that are affecting us all. So that's it. I'll wrap up and say thank you. Again, Q&A we can do downstairs at the community, but thank you.